Ladies and gentlemen, our esteemed viewers, welcome to this episode of our podcast. And on this session, we have our esteemed guest, Dr. Udemezue Ezekwesili. Shall I call you Dr. Mezue?
Yeah, Mezue is fine,
Yeah,
thank you.
so Dr. Mezue is a general practitioner in the United Kingdom, and I invited him, and he's thankfully accepted to be here to, have this discussion on a very important topic that we encounter in the men, within the society, and that's erectile dysfunction. So, Mezue, thanks for honoring this invitation, and thanks for being here.
Thank you so much, Dr. Emmanuel. Thank you for inviting me. Thank you for inviting me to the wonderful channel. Thank you for all you've been doing and the nice work you've been putting out and informative, contents to the people. And I'm pleased to be here. Thanks everyone who will be watching.
Yeah, thank you. So, without wasting much of our time and much of your time and the time of the viewers, let's dive straight into it. So, what is erectile?
Mm,
What is erectile dysfunction? What does it mean? To the general public.
right. Right. Basically, erectile dysfunction is a persistent inability to achieve and maintain an erection
Right.
necessary for satisfactory sexual performance.
Right.
So
Okay.
it means that it has to be something that has, is persisting in terms of it's happening over and over again. Some people try to put a time on it and say, okay, it's got to be up to 6 months of not being able to have an erection or to maintain an erection, okay, such that you'd have a satisfactory sexual intercourse. Basically, when you look at, you can pick out the three parts. So first of all is that it has to be persistent, okay? So because people have, sometimes they are not able to have an erection, and a one-off episode or episodes that are few and far in between. So the persistence is important.
Right.
And then
Okay.
obviously there's an inability to either have an erection, or when you have the erection, to sustain it long enough for you and your partner to be satisfied sexually. Okay.
Thanks,
Yeah.
thanks,
So
thanks for that really detailed, definition explanation. You've been a doctor for 11 years now, if I'm not mistaken, and I think
yes,
you've been a general practitioner
yes,
for about a year now or thereabouts.
yes,
In your practice,
yes.
how commonly do you encounter, people presenting with this problem?
Yeah, erectile dysfunction is quite common. It's something that mostly men would talk about as
Right.
a second or third reason for attending.
Okay.
Um, Very rarely people come up with erectile dysfunction as their first reason for coming, even though quite a number of people are confident to do that. Some people feel, and there's a great degree of underreporting in the sense that patients are not confident to come to the reception and say they've got problems with their erection. So sometimes they come with other problems, and
Right.
then during the consultations they raise that particular concern. So
Okay.
it's it's quite common
Mm.
in men to have that.
Right. And hinging on that, what's the reason why men might not feel confident, opening up initially about this problem? What do you think, or what have you
Yeah,
seen from your practice?
yeah. I think it's something that maybe publicly
Yeah.
people don't talk about enough
Okay.
as a medical condition.
Right.
Okay, so some people have a degree of stigma or not being so sure of
Mm.
how they will come across. Meanwhile, it's
Right.
a medical problem that anyone should be able to talk about when they have such problems. Some people feel they are inadequate, they will be misunderstood because it's a personal, something to deal with someone's private life. And as it is for a lot of men's conditions that
Mm.
have to do with either their personal lives or their mental health, they
Yeah.
sort of there's still a pushback from men to come up and discuss it. Yeah, so
Right.
those are the reasons
Okay, we'll get back to that. In terms of how how we can encourage people to speak up about this problem more freely. So thanks for all you said so far. I've just been curious about this erectile dysfunction, and I was just wondering, nowadays we see a lot of adverts on social media on enlargement of the penis, and I'm just
Yeah.
wondering, if are men really engaging with these pills and creams, and if yes, could it be contributing to erectile dysfunction? And
Yeah.
secondly,
Yeah.
yeah,
Mhm.
secondly, could you also tell us if we're encountering a lot of erectile dysfunction among young men as well?
Yeah. Okay, yeah, yeah, quite rightly. The I would say sexual performance industry
Mm,
is something that has become very booming and very lucrative because of certain promises that it's
mm,
people or the entrepreneurs in the industry
yeah,
claim to deliver. Okay,
right.
some of those things have not been substantiated through research. Okay, and so averagely there is an average size of penis size which when you look at country by country and region by region, so sometimes people have uneducated expectations of what the penis size should be,
Right.
except one has what is defined as micro penis, in terms that you've been diagnosed with a small sized penis which is under what is expected to be or the average of for someone of your age and race, then
Mm,
that can contribute to erectile dysfunction. Ordinarily, most people with an average size penis are fine with it. Okay.
okay.
Yeah. So
That's
the challenge
that's
is that
reassuring to know.
yeah, so a lot of
Yes.
people worry
Yes.
maybe by listening to what is said on the media,
Mm,
by popular persuasive advertisement,
yes.
and through somewhat I would say some of those things can also be attributed to things like pornography
Mm,
that sort of sets an unnatural expectation for people. They begin to feel insufficient.
right. Yeah.
Meanwhile, they are all right. Yeah.
Mm,
So with substances people take, is something that caution needs to be applied, because if you take herbs and things, they could affect your kidneys, which will end up affecting your blood vessels and how your nerves work, which would ultimately lead to erectile dysfunction.
right.
Also, some of those substances may react with some certain medications that people use routinely,
Yeah.
and which would end up making them have erectile dysfunction. So
Right.
it's something to be cautious about, I would say. Most
Mm,
people are normal, to be honest, with
right.
terms of size.
Yeah.
Yeah.
Okay.
Yeah.
What's the common age range of people of patients you encounter, presenting with this problem? And does it happen in young people?
Yeah. Yeah. I think erectile dysfunction can happen at any age, okay? But based on the natural incidence of the disease or how much it affects the population based on age, mostly when people go above 40, especially between 40 to 70, there's a threefold risk of having erectile dysfunction. So most of the people I see are mostly between their 50s and 60s. Um, this is partly due to the fact that people have had more problems with their blood vessels, their heart, their nerves. They might be diabetic at the time. They might have kidney problems, or any other blood vessel problem that could contribute. Young people, more recently, there's been finding some researchers have seen that a lot of young people do come with erectile problems, but a lot of them, to be fair, have more of these psychological causes. Okay, are more common with with younger people, in terms of people who have anxiety, depression, and people who have suffered from trauma in the past and are suffering from post-traumatic stress disorder.
Mm,
And can these are the things that can affect their erection in younger people. Also, people who have new partners, who change partners frequently, the expectations might, might be out of sync. Again, we find that younger people also, because some people in their younger ages are more likely to do things like substance abuse, like cannabis,
Yeah.
heroin,
Yeah.
anabolic steroids, and alcohol and smoking as well,
Mm.
would contribute to that. And then obviously, sedentary lifestyle is becoming more of a problem now. People work remotely
Mm.
and don't exercise as much. So
Yeah.
obesity in young people
Right.
reduces androgens. Yeah,
Mm.
yeah.
Right. You made mention of things like, some mental health, anxiety, depression. You also mentioned
Mm,
performance anxiety. We've just
mm,
gone through the month for men's mental health. That was last month.
yeah,
And even people are still talking about mental health in men.
yeah.
How does erectile dysfunction and men's mental health really tie up in terms of, you've mentioned it can cause it, but then how
Mm,
does erectile dysfunction influence or affect the mental health of a man?
mm. Yeah, yeah, like you rightly pointed out, about 10% of all erectile problems are psychological in terms of if people have general mental health problems like anxiety and depression, most times they have difficulty getting aroused. Okay. And one of the things that point to a more psychological onset of erectile dysfunction is if it comes suddenly, if the person has mostly with low libido, and with sudden onset of erectile dysfunction. And mostly they are able to achieve erection through masturbation or without having their partners there. So that points more to a psychological cause. In terms of effect, obviously it beats down the confidence of men. Okay. So it can also lead to worsening of depression and anxiety. Okay. When people feel unable to form relationships
Yeah.
because they are worried the sexual performance may be suboptimal. So that would even lead men to more depression, more isolation, difficulty forming long-lasting relationships, and loss of confidence as well. So these are things that erectile problems cause for men, and it's important to highlight to men that if you have either psychological problems, that it could affect your performance. And your performance being affected is something to seek help for. It might be a pointer to a wider psychological or mental health problem you're suffering. Yeah.
Okay. Now, I know we've talked about several causes, but let's just bring those causes together. What, apart from the psychological, causes of WIP, erectile dysfunction, what are some of those physical health problems that can also lead to this erectile dysfunction?
Yeah, very importantly, problems with blood vessels,
Hmm.
such as cardiovascular problems like strokes, hypertension, raised cholesterol,
Right.
are the chief. So heart problems and blood vessels problems, account for about 40% of causes. Then be coming after that will be diabetes. So both type 1 and type 2 by diabetes because of its effects on the nerves and also on blood vessels. People who also have trauma, sometimes unfortunately people have trauma, back injuries, pelvic injuries that can affect the nerves that supply and the penis that helps you to achieve blood flow and erection. Okay.
Yeah.
Sometimes people have structural problems in the penis, abnormal structures, any extra holes on top or below the penis, any abnormal curves on the penis, any abnormal um, sort of scarring within the penis can cause that, and that's why people should seek help if they notice such things. Obviously, there are problems with hormones as well. When men have low hormones, what we call hypogonadism, some people have low testosterone, which can affect their erection as well. Then obviously lifestyle, like sedentary lifestyle, obesity, like I mentioned, will reduce your androgens, someone's androgens. Surprisingly, it says that men who cycle more than 30 minutes a week are at risk of erectile dysfunction. So one would think that cycling is a great thing to be engaged in,
Yeah.
but there's a feeling that if you're cycling, especially if your seats are not the proper type of cycling seats, you could put pressures on the nerves and your blood vessels around the pelvis, and which
Right.
would contribute to that.
Okay.
Yeah, so
Mm.
yeah, those are more of the what we call the organic causes.
Yeah.
Yeah,
Okay.
yeah,
In addition to the
yeah.
mental health, psychological causes, right? Coming to
Mm,
still on things that can cause it, I was just wondering because you made mention of
mm,
masturbation, previously.
mm.
When can masturbation lead to erectile dysfunction? Can it damage the penis?
Yeah, masturbation is the effect of masturbation on erectile problems is a controversial one. Okay,
Right. Yeah.
while clearly things like traumatic masturbation,
Mm.
in terms of when someone masturbates, they can damage the small blood vessels and
Right.
veins in the penis, which would prevent blood flow and the soft parts of the penis from getting enough blood. So frequent masturbation, especially people who masturbate in situations that are not um, especially maybe when not lubricated or when they are under pressure, can lead to injuries to the penis and the blood vessels. Again, it's been found that people who habitually masturbate might um, have difficulties with then having erection when they are with a partner. So they have more hardness when they are masturbating than they would normally achieve during partnered sex. So it's a controversial one. While some people think that there's a degree of mild way of masturbating that can help the
Right.
health of the penis
Mm.
and blood flow
Okay.
in the penis, like how you'd exercise every other organ.
Mm.
Yeah.
Is that what is called jelking? The jelking penis exercise. Is that the healthy masturbation?
Well, even though it's been mentioned that
Mm.
way,
Yeah.
but it's something that is purely controversial.
It is okay. Mm.
Meanwhile, things like Kegel exercises,
Yeah.
pelvic exercises are great.
Right.
Okay,
Okay.
great way of regaining blood flow
Mm.
to the pelvis and the penis.
Right. And when this erection that men get in the early hours of the morning, how
Mm.
how does that help a man know how does it give a man insight into his erectile health and general health, that morning erection?
Right,
Yeah.
right. So morning erection, while some people think it's something to concerning, feel shy about it, it's actually a pointer that there's good health in the pelvis and in the penis. Okay, so the blood flow is you're well relaxed. Most men will get an erection in the morning. So early morning erection is a positive thing rather than a negative thing. And when people lose early morning erection, it could be a sign that the problems leading to erectile problems are more organic. Okay.
Right. Okay.
Um. Yeah.
Mhm. So,
So it's still a good thing for men to
right.
watch out for
Yeah.
how frequently they are getting early morning
Okay.
erection.
So for those of you viewing, this podcast, if you notice that you're still having your morning erections, I think you should be happy. And if you're not having your morning erections, then you should be speaking with your doctor, either Dr. Mezue or any other doctor that is within your reach. So, Dr. Mezue, on a typical day in your clinic, if a patient comes to you with this problem, how would you normally approach it? What will you usually do to help
Right.
them?
Right. For patients who come to with erectile problems, it's
Yeah.
important to give them enough time and to acknowledge the problem as something that is worth talking about,
Yeah.
because most men feel low in confidence. They don't want to talk about it. They
Mhm.
shy around it. So giving them that acceptance that it's okay to talk about this is a good starting point.
Right.
Then we go on to explore how long it's been going on and take a history around their erections and if they've got any risk factors like we've mentioned among the causes. We also will need to pay attention to their mental health, what has been happening with them, what has been happening with their relationships, partners, if they've had past experiences, past traumatic sexual experiences. So when we gather a bit of information about their health, their mental health, and their medications they are using, as well as their relationship life and also their lifestyle. We go in to examine them to see their blood pressure, their weight, check their BMI and their waist circumference, and then have a cursory examination of the penis just to see, and the testes just to see if they are all right.
Okay.
Some people might need blood tests to check their hormones and to check their sugar and their cholesterol levels, to do like a screen of their blood vessels and the heart.
Yeah.
And then when all of that is out, then we can encourage them on the best steps going forward.
Okay. And before we close this session, I just want to ask, could erectile dysfunction be a pointer to prostate cancer? Because I know some men might be worried about prostate cancer when they begin to have this problem. What will you say to
Yes. Yes, I think so. If people who have got prostatic enlargement could have problems with erection, okay, and also sometimes for people who have already undergone treatment for prostate cancers like radiotherapy and surgeries, they clearly might have a complication with that.
Yeah.
So if one has erectile problems,
Yeah.
part of the examination we would do would also include to examine their prostate. Okay.
Yeah.
But obviously screening for prostate cancers will depend on if they've got, any history suggesting of prostate problems itself.
Right.
So while they can be related, it is not a direct symptom of prostate cancer if you've got erectile dysfunction, because most men, to be fair, above 40 to 70 would have at least a moderate degree of erectile dysfunction. Okay, so which is normally age related and different from prostate. Surprisingly, something that that erectile dysfunction can be a predictor of is cardiovascular disease or heart problem.
Yeah.
So if someone has an erectile dysfunction, it's alone is a risk and a predictor that they might have strokes or heart problems in the future.
Yeah.
So that's why we encourage people to have a check when that comes up.
So, as a closing statement, Dr. Mezue, what advice will you give to men who might be feeling shy, insecure, and probably anxious and not knowing how to approach this problem they might be experiencing? What advice will you give to such people?
Yeah, so I would say don't be shy. Okay. One is that erectile dysfunction is something quite common,
Yeah.
especially when people go above 40. So it's okay to seek help, first of all, speak to your health professional, get advice, get an appointment. There's opportunities if you want to speak to a male colleague, if you feel more comfortable. It's not an emergency, so you can book a slot and wait for when a male colleague is available to speak to them. There are also very good sites by the British Association of Urologists and the NHS sites as well, where people can get good information on erectile dysfunction to read about in preparation for their consultation that they would have. It shouldn't be a substitute for consultation, reading on information sites, but just to prepare well for that consultation. So I would say don't feel shy, don't feel it's something unusual, and come up with GPs and other health workers are willing to point you in the right direction of what could help.
Yeah, thank you very much, Dr. Mezue. This has been very insightful, and I believe a lot of men and even ladies watching this found it very insightful and educative. And hopefully, this would help enlighten people and broaden their minds on this topic, and then they will know how to seek help if they find themselves
Definitely.
experiencing this. So hopefully we will talk about prostate cancer in another session of this podcast.
Yes. Yes.
I
Yes.
want to say a very big thank you for honoring this invitation to be here and giving us your wealth of wisdom and insights from your experience. Thank you very much.